You know, it is Rally for Red today, and I'm going to go on over and see Dr. Hurst because, you know, you've heard us talk a lot about heart health during our Rally for Red campaigns, right? Well, you know, we've talked about all kinds of signs and symptoms to look for. Well, what if you are the picture perfect of health? You eat right, you exercise, you go to the doctor, and they tell you, hey, just keep doing what you're doing. Your blood works perfect. Well, guess what? That is exactly what happened to me. But I knew I had some family history, and I wasn't convinced all was good, so I decided to dig a little deeper, and I was shocked at what I learned. Dr. Todd Hurst, cardiologist from the Mayo Clinic, he broke the news to me after I visited the Heart, Health, and Performance Program. And before we learn about this amazing program, Dr. Hurst, tell me what I learned.
Well, you know, you are an example of similar patients that we have oftentimes that have family histories of heart disease. They really are the picture of health. We look at their numbers, everything about them, their lifestyle choices are pristine, yet they have that family history that's of concern, and through an ultrasound test of the neck arteries, we found out that in fact you weren't at low risk, you were at much higher risk than we would have expected without that information. And
I'll tell you what, after we discussed it, I was like, this is why you created this program, the Heart, Health, and Performance Program, so that people can actually take preventative steps. Tell me about the program. What happens during the day?
Yeah, exactly. We wanted to answer two questions for people. One is, what is their individual risk, taking into account their family history and all their risk factors, but maybe more importantly, how can we give them the tools that they need to optimize their health for the future? So we do some basic lab testing to assess those traditional risk factors. We do an exercise treadmill test. We also do ultrasound tests that we'll talk more about here in a bit. But probably the strength of the program is the time each person gets with real experts, about 4 hours with a dietitian, an exercise physiologist, a nurse practitioner who's a specialist in prevention, and a cardiologist, all directed towards that patient.
And the video that we just saw was a really intensive discussion that I had, and I mean, that's how we discovered really the family history and just how important of a role that actually plays. Now, the ultrasound, we've talked about this before when you've been on Sonoran Living, and to actually experience it was a huge wake-up call for me. Tell me what we see when we get the ultrasound during the health and performance assessment.
Well, in concept, it's a very simple test. It's just sound waves looking at the neck artery or the carotid artery. We call it carotid intima media thickness, or CIMT, but the test gives us very valuable information. First of all, it tells us about that person's past. It tells us how those over 200 risk factors for heart disease interact with that person's unique genetics to give them their amount of artery disease or atherosclerosis. But knowing that information, it also tells us about their future, because we know that amount of artery disease is predictive of their future risk for heart attacks and strokes.
And I know we have some video of the actual, I mean, it's amazing. The technician who's doing this procedure said, this ultrasound is literally a window to your heart.
Yeah.
The information that you learn is amazing.
There's really no other way for us to find out what somebody's real risk is before they have those heart attacks and strokes, outside of looking for hidden artery disease, and this test does that very well.
Who benefits the most from attending this program? Who's the ideal person to come in?
Well, about 60% of adults in the United States are going to develop heart disease or stroke in their lifetime, so it's unfortunately a really common problem. But the people that we're really concerned about are the ones that have family histories of heart disease, or if they have traditional risk factors like high cholesterol, high blood pressure, metabolic syndrome, also called prediabetes, or frank diabetes. Those are the people that are at the highest risk, or we're not sure what their risk is, and the program can help answer that and then optimize their health for the future.
So after someone completes the program, it's a day-long event, and everybody there takes very good care of you, by the way. You have a schedule, you know exactly where you're going. What happens next after you go through all of the testing and the family history? What happens next?
Well, a lot of it depends on what we find out from that patient. If they're at fortunately low risk, then we just emphasize the healthy lifestyle things that are important, not just from heart health, but for life and for preventing cancer and other diseases. But if we identify that that person is at higher risk, then we institute a plan for them going forward. And that may be follow up on exercise as their challenge, or maybe it's diet, or maybe it's medication.
Well, you know what, and here's the thing. You actually suggested that to me, that I actually start taking some cholesterol medication, because it's not necessarily, my risk is very low now. It's later. It's really 10 years from now that I could potentially have some serious problems.
Well, because you've done such a nice job of minimizing your risk from all other standpoints. You lead a healthy life, your numbers were all ideal. We're really looking for what can we do to change this trajectory of how much artery disease that you've developed. Cholesterol-lowering medications are the best evidence-based intervention that we have to save lives and decrease the risk of heart disease.
And knowledge is power, isn't it, in this case? It is an amazing program, and I'll tell you what, I'm so glad that I learned what I learned, because now I know I can be more proactive. So ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month we'll give you tips and tricks to keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred. Thank you so much, Dr. Hurst.
My pleasure.